in Malaysia by just flattening the curve. The reason why the authorities need to do that quickly is not to overwhelm the hospitals and buy time for patients to recover. Now, right now, over 100 patients are now in ICU. Half of them need ventilators, and Malaysia need another 500 more ventilators in order to be prepared if the situation were to take a turn for the worse.
Mel, the country remains under lockdown until at least April 14th. Authorities have reported to arrest more than 4,000 people for violating the government's movement control order. Could you give us more details about that?
Well, the movement control order, or MCO, enter its third week, or the second phase, so to speak, is expected to be tightened further with the one person in one car policy, not moving beyond the 10-kilometer radius of your residence, which means those who come out to shop and buy food or the daily essentials should do so nearby and go home quickly after that. Malaysian police and army said must keep up with this social discipline for safe distancing. The next 2 weeks are crucial in flattening the curve and preventing community spread. There are some 60,000 police and army personnel manning roadblocks, patrolling Klang Valley, the area that's worst hit, the most densely populated, as well as in other states. The message from the army especially is very sharp and very direct, to the point. If you choose to disobey the order, not to stay at home, you have only three options. It says either to be jailed, hospitalized, or you're digging your own grave. It's that plain and simple, although rather morbid. It's all to drive home the point, stay at home, or the authorities will get you. Now, over 170 people is charged in court, some jailed for disobeying the order, and it's unclear whether this order will be extended after April 14th. The numbers will show. The authorities likely to make a decision at the end of the third week.
Thanks for that. Melissa speaking to us from Kuala Lumpur. Thailand will impose a nationwide curfew starting this Friday to curb the spread of COVID-19. That's according to Reuters, citing a government statement. The curfew will take place between 10 p.m. and 4 a.m. But there will be some exceptions, such as the transport of medical supplies, the travel of patients, medical personnel, and the movement of people into quarantine. Thailand has reported 104 new infections and 3 more deaths from COVID-19. Total infections are close to 1,900. 15 people have died so far. The cabinet will consider a new package of economic measures on Friday. It's aimed at mitigating the impact of the coronavirus over the next 6 months. The government has said the new package would be worth more than $15 billion. A plan to issue a law to borrow funds will also be discussed. Indonesia may change the national holidays for Eid to prevent the mass movement of people travelling back to their hometowns at the end of the Muslim fasting month. This comes amid concerns over the spread of COVID-19. Speaking in a virtual meeting with some members of the cabinet today, President Joko Widodo says entry fees to visit tourist spots may also be waived during that period. The Eid public holiday in Indonesia this year is between the 22nd and 27th of May. Many Indonesians have already started to return to their hometowns early as business slowed amid the COVID-19 pandemic. Mr. Widodo adds that Indonesians who arrive in their hometowns will need to be monitored for possible infections. Last year, nearly 20 million Indonesians traveled across the country for the Eid holidays. Mr. Widodo also asked the Health Ministry to provide the criteria for regions who want to impose the large-scale social restrictions within the next 2 days. Meanwhile, several regions in Indonesia have imposed a curfew to limit people's activities, which is part of a growing effort to stop the spread of the coronavirus. This follows Mr. Widodo's declaration of a public health emergency on Tuesday and the implementation of large-scale social restrictions. Safwan Ismail tells us more.
It will take some time for people to get used to these curfews, these new curfews, but the majority of them do understand the seriousness of the pandemic. Some local leaders have said it has received a good response from the community. They have been cooperative. Now, under the public health emergency, regions can impose large-scale social restrictions. For example, the port city of Balikpapan in East Kalimantan province has imposed a curfew from 8 p.m. until 4 a.m. However, residents who need medical attention and those tending to the sick in a family would be exempted from the scheduled road closures. Now, online food delivery services are also exempted. In Sika Regency, Eastern Nusa Tenggara, individuals violating the curfew, which starts at 7 p.m. and ends at 5 a.m. will be fined about $60 US. Community leaders have also taken their own initiative to limit the movement of people. For example, a neighborhood consisting of urban villages would not be able to prohibit low-income residents from leaving their homes. Now, community leaders said restricting access is only feasible in smaller areas such as the more well-off communities in which residents have the resources to fulfill their needs during a quarantine. Now, tensions have been brewing between the central and local governments over different approaches to the outbreak. Mr. Widodo has warned the regional leaders not to make policies of their own and to follow the regulations from the central government. Mr. Widodo has said that he believes so far regional governments have largely adhered to the instructions from the central government. Now, Mr. Widodo also visited a newly constructed hospital to treat COVID-19 patients in Galang Island area of Islands province on Wednesday.
Singapore has confirmed its fourth death related to COVID-19. An Indonesian national died from complications due to the disease. The 68-year-old had underlying conditions of diabetes and hypertension. The Singapore Work Pass holder had been in Indonesia from January 20th to March 16th. Yesterday, the country reported another 74 new cases, taking the total tally to the 1,000 mark. A new cluster with 10 cases has been identified at the Lee Amoy Old Age Home at Thomson. 8 of them involve residents, with the oldest aged 102. The remaining 2 are a staff and her family member. These cases were tested after the first confirmed case at the home on Tuesday, according to the Agency for Integrated Care. Of the 54 new local cases, 2 are linked to another new cluster and a dormitory at 55 Sungai Kadut Loop, and the total in this cluster is now 3. 3 of yesterday's cases are from the public healthcare sector. 2 of them are staff at the Singapore General Hospital. 1 is a clinical research coordinator and the other a nurse. The third is a doctor at Ng Teng Fong General Hospital. There are currently 25 unlinked cases. Contact tracing is ongoing. 20 of Wednesday's 74 cases are imported with travel history to Australia, Europe, South America, Africa, ASEAN and other parts of Asia. Staying in Singapore, new laws will be introduced to make it mandatory for landlords to pass on property tax rebates to their tenants. It will also ensure the process is done in a timely manner. The new legislation will be introduced in Parliament next week. This follows Deputy Prime Minister Heng Swee Keat's budget speech last month, urging landlords to pass on property tax rebate by reducing rentals. Landlords of non-residential properties such as hotels and malls will receive a property tax rebate of up to 100% for a tax payable this year. When the new laws kick in, property owners would be obliged to pass on the full amount of the tax rebate for their properties. Landlords cannot impose conditions when passing on the rebate. A valuation review panel can mediate should a dispute arise between landlords and tenants. The Finance Ministry said landlords who don't comply without good reason will be guilty of an offence. Details of the rebate to tenants will be made available on the Inland Revenue Authority of Singapore website. Business news coming your way next, and as the global airlines reel under the impact of the COVID-19 pandemic, there are signs of gradual recovery in China's domestic aviation sector. We'll tell you what's boosting the demand when we come back.